Chosen partially because it's near public transportation, but also because it's close to communities of color where vaccination rates are lagging behind their white counterparts all across the country. Once residents make an appointment, all they have to do is get to the site to get vaccinated. Still, though, that's a challenge for many people. In this News 5 original, I found out how some communities are already overcoming that barrier.
I talked to a lady yesterday. Her husband's in a wheelchair. She doesn't read or write.
That's why Maureen D's work getting Cleveland's Hispanic community vaccinated is a huge logistical puzzle. Many people are able to sign up online for a vaccine appointment and show up to get their shot at CSU's mass vaccine location. But other members aren't tech savvy, don't get around well, or are intimidated by a part of the city they don't go to often.
And so this is the community that we're trying to assist to connect with the vaccine.
FEMA and state agencies have already reached out to Cleveland's Hispanic Roundtable, setting aside 1,500 appointments at the mass vaccination site over the next 8 weeks. The next steps for Maureen is to make sure people are scheduled for those times, make sure they know where to go, and that they have help overcoming any language barrier.
We need to be so sensitive to those communication challenges and cultural challenges that the individuals face.
The mass vaccine site opening this week isn't the only way to get underserved population their shots. In Glenville,
I have to be honest, I wasn't going to get it at first, but I changed my mind.
Brenda Benton wants to travel soon, and Johnson & Johnson's one-shot vaccine means she only had to brave a needle once. She's gone from skeptic to the vaccine's biggest champion.
Hopefully everybody will get vaccinated. Hopefully everybody will come out and just do it. Let's just do it.
That's a big deal for Dr. Ola Luafayanju.
It means everything. It gives me a ton of hope that people can change.
He's running Oak Street Health's vaccination program. Their locations are already in underserved communities, so instead of transporting patients downtown, Oak Street Health is getting vaccines from university hospitals for patients like Brenda. Last week, they started with 300.
It's a small dent, but one of my favorite sayings is, how do you eat a whale? One bite at a time.
Dr. Fayanju says the mass vaccine site is better for some people and Oak Street Health is better for others. What's more important is giving people options and telling them about patients like Brenda.
The authenticity of her experience will touch more hearts, and her example will probably do more than anything that I can say.
I'm hoping that it will change the minds of people that just don't believe.
The Hispanic Roundtable tells me that they're continuing to vaccinate people in the Hispanic community through their local churches and neighborhood family practice as well. They've already been doing that work. That makes it a little bit easier on people who still won't be able to get to the mass vaccination site even with their help.